Good afternoon, Taylor Pinto. Let's begin the warm-up session. Why did you choose to become a nurse?
There are several reasons why I chose nursing. First of all, many of my relatives are nurses and their stories inspired me a lot. Besides, nursing is a profession with an ocean of opportunities both native and abroad. Above all, this is a service-oriented profession in which I can serve humanity. Hence I chose nursing as my career.
Why did you choose OT?
It is my long-term ambition to work as a registered nurse in any English-speaking country such as the UK, Ireland, and so on. To meet the requirements to register as a nursing professional there, I need to prove my English language proficiency. Hence I choose OET to fulfill my dream. Moreover, OET is tailored according to the needs of nursing professionals, therefore I believe I could perform well in this test.
What are the current trends in your profession?
Nursing is a dynamic profession and changes happen daily. Nowadays technology plays a vital role in my profession. For instance, paper records that we used in older days have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for every procedure. Moreover, in present days a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
Do you have a role model?
Yes, I do. My role model is my mother. I follow many things that my mother does. It is from my mother I learned the basics of kind behavior, decision-making, and organizing skills, a polite and humble manner, helping and sharing mentality. The care and respect she gives to everyone makes me wonder sometimes. She is a perfect example of womanhood. I believe a nurse should possess all these qualities. She is my superhero.
Where do you see yourself in 5 years?
In 5 years, I envision myself as a seasoned nurse, working in a challenging and rewarding role. I aspire to deepen my clinical expertise and leadership skills and to become a valuable asset to my healthcare team. I hope to be involved in mentoring and educating new nurses and to contribute to improving patient outcomes through evidence-based practice. Ultimately, I strive to make a positive impact on the lives of my patients and their families. Good morning. I'm Taylor Pinto, one of the nurses here. What brings you here today?
Nurse Taylor, well, I fell earlier today while I was at home. My hand has been hurting a lot since, and I'm worried it might be something serious.
I'm so sorry to see you've had a fall and hurt your hand. Let me assure you that you're in good hands, and we'll do everything we can to help you feel better. Well, for documentation purposes, may I know your name, please?
My name is Mihira.
I'd like to start by understanding more about what happened so we can provide the right care for you. Could you tell me in detail about the fall?
Sure, I was carrying some laundry downstairs and slipped on the last step. My hand hit the floor hard when I tried to catch myself. The pain was immediate, and I've been finding it difficult to move my fingers since then.
Thank you for explaining that. It sounds like it was a sudden and unexpected incident. I'll take a closer look at your hand soon, but first, I'd like to confirm, did you notice any other injuries or areas of pain, apart from your hand?
Not really, though my wrist feels a little stiff too.
All right, Mihira, I appreciate you telling me. Mihira, from what you've described and what I can see, it seems the injury is localized to your hand and possibly your wrist. However, we'll need to assess it further to make sure there are no underlying issues, such as fractures or deeper injuries, that need attention. Let's take this step by step so you feel fully informed and at ease. Now, let me explain what we're going to do next. First, I'll clean the wound carefully to remove any dirt or debris. This is an important step to prevent infection and help the healing process. After that, I'll examine the area more closely to check for any signs of deeper injury or swelling. Once that's done, I'll apply a protective dressing to keep the wound safe and clean as it heals. If I notice any swelling, I'll use a cold compress to help reduce it and provide relief. You can also continue using cold packs at home to minimize swelling if it persists. I'll explain everything as we go, so you'll know exactly what to expect. Do you have any questions or concerns before we get started?
That sounds fine. I'm just a little worried about how severe it could be.
I understand, Mihira. Let me also reassure you that this kind of injury is quite common, and seems not serious. Most people recover well with proper care. We'll make sure you're on the right track to healing. Once we've cleaned the wound and dressed it, the doctor may recommend an X-ray to rule out any fractures. It's a precautionary measure to ensure nothing is missed. Do you have any concerns or questions?
Okay, that makes me feel a bit better. Will I need to come back for follow-ups? And how long will it take to recover?
That's an excellent question, Mihira, and I can understand how important it is for you to know what to expect. Let me reassure you that we'll guide you every step of the way. Depending on what we find during the assessment, there's a possibility you might need a follow-up visit, but we'll make sure you have all the information and clarity before you leave today. Typically, wounds like this take about a week or two to heal, but since we need to evaluate things further, I'll provide you with detailed aftercare instructions to ensure your recovery goes as smoothly as possible. In terms of aftercare, let me explain how you can take care of the wound at home. Once the wound is cleaned and dressed, it will be important to keep the area clean and dry to prevent any complications. If the dressing happens to get wet or dirty, replacing it with a fresh one is key to avoiding infection. For any discomfort or pain, you can safely use over-the-counter medications like paracetamol or ibuprofen, provided you don't have any allergies to these. We'll make sure you feel confident about managing this at home. Does that all sound clear to you so far?
That's helpful. Is there anything I should watch out for while it's healing?
Absolutely, Mihira. Keep an eye out for signs of infection, such as increased redness, swelling, warmth, or discharge from the wound. If you develop a fever or notice the pain getting worse instead of better, come back to the hospital or visit your GP immediately. Do you have any other concerns or questions before I begin treating your hand?
No, I think you've covered everything. Thank you so much for explaining things so clearly.
You are very welcome, Mihira. Can I get your consent to begin treating your hand, Mihira?
Yes, I consent to you.
Thank you, Mihira. Let's get started on caring for that hand now.